My name is Mar Cristaliana, class number 115B. Together with B2 Group, today we're going to discuss Module 11, Diabetes Mellitus, also known as Diabetes is a chronic disease that occurs when the pancreas is no longer produce insulin or when the body is no longer reacts to insulin to help the glucose enter to the cells. Diabetes cannot be cured but can be controlled with a diet and exercise, medications, or injections of insulin. The main goal of diabetes management is to prevent long-term complications and to keep the blood glucose within the normal range. Hypoglycemia and hyperglycemia are two types of complications of diabetes which should be avoided.
Pathophysiology of diabetes mellitus or DM is commonly known or referred to diabetes. When we heard about diabetes, we always think that a person have a high level of sugar or glucose in the body. Diabetes is a chronic disease that occurs when the pancreas vessels is no longer able to produce insulin, or the resistance or insensitivity of insulin in our body. What is insulin or the use of insulin in our body? Insulin is an essential hormone secreted by the beta cells of the islets of Langerhans in the pancreas in response to increase the level of glucose in the blood. And it also controls glucose level by transporting it into cells so it can be used for energy.
Classification of diabetes mellitus.
Three types of diabetes mellitus. There are three types of diabetes mellitus. The first one is the type 1 IDDM or insulin-dependent diabetes mellitus. The second one is the type 2 non-IDDM. And the last one is the gestational diabetes mellitus or also known as GDM.
Diagnosis of diabetes.
Diagnostic tests used to detect diabetes vary based on the type of diabetes. First, glycated hemoglobin test. Second, fasting plasma glucose. Third, oral glucose tolerance test. Fourth, random blood sugar test. And the fifth, postprandial plasma glucose.
Signs and symptoms of hyperglycemia.
Increase of thirst and dry mouth, needing to pee frequently, tiredness, blurred vision, unintentional weight loss, and recurrent infections such as rashes, bladder infection, and skin infection.
Comorbid condition of DM patient.
DM patients have microvascular and neuropathic complications of diabetes and coincidence hypertension, obesity, dyslipidemia, and cardiovascular disease or CVD.
Other comorbidities, hearing impairment, sleep apnea, fatty liver disease, cognitive impairment.
Other comorbidities, depression, diabetes distress, eating disorders, fractures, peripheral artery disease, cancer.
Nursing consideration monitoring in DM patient.
DM patients required ongoing evaluation for diabetes-related history and physical examination, BP, cardiovascular disease, eye exam, diabetic retinopathy, foot exam, diabetic foot care, foot problems due to vascular and neurological disease are common, dental exam.
Blood example, urine vaccination, example, influenza, hepatitis B, health education, and self-management review.
Treatment for diabetes mellitus.
In addition, in making healthy food and beverage choices, getting physical activity, getting enough sleep, and managing stress, medicine can help you manage the disease.
Taking insulin or other diabetes medicine is often part of treating diabetes.
We have the OHD, or we call the oral hypoglycemic drug. The second is insulin therapy. The third is the aspirin. Aspirin is for CVD, or we call the cardiovascular disease.
Reference range for blood sugar level. Normal adults between 4.0 to 6.0 millimoles per liter, or 72 to 108 milligrams per deciliter when fasting. For people with diabetes, before meals, 4 to 7 millimoles per liter for people with type 1 and type 2 diabetes.
Prevention of complication of diabetes mellitus.
Client education, self-monitoring of blood glucose level, individualized target blood glucose level, depends on age, activity level, etc.